Welcome to the new episode of Lunch with Experts. Today we'll be talking about practice management. We often complain about increased saturation of dentists in our area, which affects our practice. The building behind me you're looking at has more than 100 practicing dentists, and every one of them has a very successful practice. So let's talk to our expert, Dr. Melissa Tuft, on how she manages to run a successful practice in such a competitive environment in downtown San Francisco. So here we are with our expert, Dr. Melissa Tuft. Thank you for meeting us.
Oh, you're very welcome. My pleasure.
She has over 30 years of experience being an outstanding faculty and also running a successful private practice. She's been into lots and lots of committee and she's very student friendly, and most important of all, she's giving back to the community immensely. Thank you so much for agreeing to be part of our show. Today we'll be talking about practice management, and we have lunch, some pesto pasta to go along with it. I hope you like it.
Oh, it smells great. Can't wait to eat it.
Yes. So I would like to talk about practice management and how you go about in your practice. How do you manage your patients? Firstly, I would like to know what kind of services do you give to your patients in this practice?
This practice is a downtown professional practice, so I am doing restorative adult dentistry. Occasionally I have children. I'm not opposed to children, but this isn't necessarily the focus of the practice. So I'm doing restorative, restoring a lot of implants, orthodontics, periodontics. I do some endo. I like doing endo. I'm getting lazier as I get older, and I'm sending more to our friend, Dr. Cohen. And I pretty much don't do any surgery.
Okay. So that's pretty much like you're covering most aspect of the general dentistry.
Right.
And we are in your building, like your office is in a building which has more than 100 practicing dentists. How do you manage to run such a successful practice?
My first practice was a storefront, and we did have walk-in patients who would just come by and come in and ask about the practice. And I thought, when I moved here, how am I going to get new patients? But the truth is, since this is the dental building for San Francisco, people are looking for dentists in this building. Mm-hmm. So if I reach out and do some other type of advertising, or they get to my website, they'll see 450 Center and they'll say, oh, I like that building. That's easy to get to. The bus lines are there. There's parking there. All the specialists are there. There's a pharmacy. And that's an asset for patients. It's a convenience.
And how are you attracting new patients? Because here in this building there are so many dentists. So how do you advertise yourself?
I have tried everything over the years, and at this point, direct mail does not work for me. Mm-hmm. Phone book ads are dead. What works the best for me is to use my website, and they have search engine optimization to help me come up the rankings, and then to encourage referrals. And we encourage referrals by asking. Mm-hmm. And making sure people have good experience.
Perfect, yeah.
And a Groupon in 2013, I retained like 10% of the patients, which is outstanding. Okay. Then I did it again in 2016, retained 0.
Okay.
So you just have to try and see what works.
Right, definitely. And I would also like to ask, like, have you ever faced a conflict with a fellow dentist, and how did you manage? If yes, how did you manage it?
The one that comes to mind is I had an oral surgeon that threw me under the bus with a patient and told the patient that the paresthesia I had sent her there for was due to using Septicane as opposed to lidocaine, which is not, I mean, that's been batted around. We've had lots of experiments on that. Dr. Tony Pogrel says there really isn't any validity to that. And the way I dealt with that was I quit sending patients to him.
Okay.
Which was interesting, because I saw him in the elevator and he said, how come you weren't sending patients to me? And I said, well, let's step out and talk about this.
Absolutely. And like we are in an urban area, and we always find high saturation of dentists in urban area. Mm-hmm. So what would be your advice to young dentists or students like me who are thinking about moving to big cities?
Practice different places. See if this is what you really want. In the less saturated places, there's going to be a certain type of practice. If you know this is what you want, and you want this kind of clientele and this kind of environment, you'll do what is necessary to make it work. So, but you need to be committed to it, because this is a very high overhead situation. And I've enjoyed it, and I've accepted the limitations of having a high overhead practice, and that is that you have to be after it and be cost conscious about other things having to do with your practice.
Definitely. So do you initially would you encourage us to join different groups or network? How would you do that?
Oh, how to be, once you get into it, how to get new patients.
Yes.
Excuse me. What I did when I came to San Francisco is I joined everything. Chamber of Commerce, Rotary, any kind of networking group. And anytime I had an opportunity to speak to a group, I would do that, even though I hate public speaking. But it gets you out there.
Right.
And then you network, and you need a lawyer, you need an accountant, and they come to your practice. And that's kind of how that works.
Right. Definitely. I think this will be definitely helpful for young students and also young dentists alike. Thank you so much for taking time from your busy practice and talking to us. I would definitely think there will be always high saturation of dentists wherever we go. But for a young dentist like us, we should always try to be an expert, because there will be always demand for experts. And this is what I think, and try to be more competitive, more competent, train ourselves harder, and this is what the key or the mantra is in today's world, right? And when you become an expert, you also get to be part of our show. Just joking. Thank you so much, Dr. Tuft. Thank you, Shruti Lakanpal, for taking this video, and we'll see you next time. That was great. Dr.